Hey everyone, welcome to my channel. Today I'll talk about a very high yield topic, and that is the topic of Kaplan Meier curve. Okay, if you are preparing for USMLE step 1, step 2, step 3, or even if you are not preparing for USMLE but you have biostats subjects, then this video is just for you because this is a very high yield topic in biostatistics. Okay. I know that by looking at the Kaplan Meier diagram, you might feel you will never understand it, but I want to promise you that I'll make this concept very clear step by step, and by the end of this video, you'll be able to easily gain points from this topic on the exam day. Okay, so let's proceed. What is the Kaplan Meier curve? Okay, so Kaplan Meier curve is actually used in the medical research to study time to event data, and most commonly the event is death. The event doesn't necessarily means that the event should be death. Okay, it can be anything, but it will be event of interest. Okay, it can be disease recurrence, progression, or any outcome that is being studied. Okay, to understand the Kaplan Meier curve, first we need to understand how it is constructed. Okay, so for that, the x-axis, okay, the x-axis shows time in days, months, or even years. Okay, most of the time it will be years. Okay, the x-axis denotes time from the beginning to the end of the study period, whereas this y-axis actually denotes the cumulative event-free survival starting from this 1% to 100%. Okay, 100% of patients have it starts from here. Okay, and 100% actually this 100% of patients have not experienced any event. Okay, we need to understand that at the beginning of this study nobody will be experiencing any event. Okay, and as the study progresses, what is there is that event occurs and the proportion of subjects at risk for an event of interest decreases. Okay, and there will be a downward dip. Okay, this is what it denotes. Okay, now this is this Kaplan Meier curve is actually a step down curve. It is not a smooth curve. Okay, now first I'll give you an example in this diagram so that it will be clear, and then we will move to the first diagram. Okay, so always the Kaplan Meier curve, as I had said earlier, it starts from 100% survival. Okay, so the line stays flat. Okay, the line stays flat. Let me adjust my iPhone. Okay, then the line stays flat. Okay, and when until there is no event. Okay, no event occurring, and when the event occurs, it is vertically, it dips down. Okay, vertically. Okay, this is the when there is any event, it dips down. Okay, and then again it goes flat. Okay, and then again there will be vertical dip down. Okay, and then if there is a larger vertical drop, then what it is like more event is occurring. Okay, we need to understand this much. Okay, more events have occurred at this time. For example, I will give you an example so that it will be more clearer. Okay, so suppose there is 10 patients. Okay, and like at almost around 3 years, one patient is dead. Okay, so then what happens is we'll start at the 100% survival. Okay, now it will go flat. Okay, and at around 3 years, what happens is there will be a vertical drop. Okay, this vertical drop shows one patient is dead, so there is an event occurring, and here event is death. Okay, so suppose this now 9 patient is left. Again, sorry, I'll just change it. Okay, now 9 patient is left. In that 9 patient also, at around, suppose at 4 years, this 4 years of time, there is 2 death. Okay, then what will be there? It will go straight until 4 years, and then there will be a vertical dip down. Okay, that is two death. Okay, now you can clearly see, look, here one patient is dead, so the dip is smaller, but here two death has occurred, so dip is larger. What it means is that the larger the vertical drop, the more events have occurred at this time. Okay, so this is a one simplest way to understand the line, the curve. Okay, key this Kaplan Meier curve. Okay, now what is we expected to answer whenever there is a this diagram given? Okay, suppose we might be asked about the median survival. Okay, or we might be asked with like what is the I'll explain in this diagram first, and then you will understand. Suppose there are two treatment given. Okay, suppose this is the blue line represents treatment A and this red line represents treatment B. Okay, and now we can easily see there are stepwise diagram. Okay, and certain there are vertical dips that are larger, there is a smaller dip. Okay, but these are not crossing each other. So what are the things we need to expect in this question? Okay, so there will be like, what is the median survival time? In this question we can be asked in that. Okay, so what is the median survival time in this? That means like the median survival is, we will be looking at survival at 50%. So we will be looking at survival at this 50%. Okay, so we will just go on the straight, we'll draw a horizontal line straight across the across this curve. Okay, so this the median survival for, suppose for treatment B will be 3, right? This will be 3, whereas for the median survival for this treatment A will be 7, right? So which will have the better survival time? Of course, treatment A will be better, it will have the better survival time. So this can be one possible questions from this KM curve. Okay, the other one can be, what will be the better survival prognosis at certain years? Okay, suppose they are asking like at 5 years, what will be the like which will have the better survival prognosis? Now look, at 5 years we can see the treatment B has this 20% of survival, right? But in cases of treatment A, it has what? It has 5 years, right? Okay, so it has, so this is 5 years, so it has 70% survival. Okay, so this is, let me adjust my iPhone. Okay, now this has 70%. Okay, so this can also be one possible question. Okay, now the other one can be like, there can be cumulative incidence of the event. Okay, now what will be the cumulative incidence of the event? That will be 1 minus the survival percentage. Okay, so if the survival percentage is 40, then the cumulative incidence will be 1 minus 50, or not, let's not say 50 because that will be 50%. Okay, let's say if survival at 4 years is 60%, then the cumulative incidence of that event is 100 minus 60%, that will be 40%. Okay, so this can be the questions that can be asked from Kaplan Meier curve. Okay, now there will be two Kaplan Meier for the two different treatments, and we are asked to compare. Okay, and they will ask what will be the median survival time, or which treatment will have the better prognosis at certain years. Okay, and the other will be cumulative incidence of the event. Okay, sometimes there will also be asked about the where is the sensor data. So we can see wherever there is this cross mark, there will be the this sensor data. Okay, so, and the other one will be like what does the greater vertical dip means. Okay, that is like more events. Okay, so the other one is like here the two Kaplan Meier graph is not crossing each other, right? But there can be certain condition where two Kaplan Meier graph can cross each other, okay, like certain in this kind of Kaplan Meier diagram, okay. In those cases we can't compare, like we won't be able to derive these median survival time, better survival prognosis. In those cases what we look is, we look at the p-value, okay. We look at the p-value, okay. And in those cases we look at p-value, and we know that p-value like less than 0.05 will be significant, right? So suppose what does log rank test is, it will compare the survival curves, okay. It will compare the survival curves, and this compares the observed number of events with the expected number of events between the groups, okay. And what it does is, it tests the null hypothesis, okay, that there is no difference in survival between the groups. And there might be the question like, which tests will be need to be recommended, or is there any significant difference between the outcomes or not, or there is no significant difference between the there is no significant difference between the two test groups. There might be certain questions, but how can we decide on that is, like, suppose if there is p-value that is less than 0.05, okay. Suppose if the p-value is like 0.03, okay, that is less than 0.05, that indicates a statistically significant difference between the survival curves, and the null hypothesis is rejected. But in certain cases there might be p-value like 0.3, so that is not less, right? Then there will be no statistically significant difference, and the observed difference could be due to chance, okay. So log rank test is also something that you should keep in the back of your mind, and it compares the entire curves, okay, not just the individual time points, okay. Now let's summarize what we have learned till now, okay. So it is Kaplan Meier curve is actually a survival curve, okay, used for this time to event analysis, okay. And we need to remember, it is a step down curve. Whenever you see any kind of such kind of curve, that is a step down curve, that is a Kaplan Meier curve, okay. You don't need to worry, you don't need to panic, you just need to remember it starts from the 100% survival percentage, and then there will be a vertical drop. Vertical drop is always representing event occurring, okay. And if there is certain tick mark, or if there is cross mark, then that represents censoring, okay. And always remember, the large drop means there is large number of event occurring, okay. Sometimes we might get confused that large drop represents censoring, but large drop actually involves the number of events, okay. And higher curve represents better survival, okay. And this log rank test is used to compare survival curves, and p-value less than 0.05 indicates a statistically significant difference, okay. That's all for today. Happy New Year Eve, guys, and keep studying, keep learning, one step closer to match day. If you like this video, if you want more video, you can comment on which part of the which topic of biostatistics you like me to upload or make a video. I will be very I'll be very happy to upload those topics. Thank you so much. Bye bye, take care and stay blessed. Bye bye.